Okay, good morning, everybody. My name is Lynn Ladd, and it's my honor and privilege today to represent the Ottawa Board of Trade. And I am excited to have some special guests here today, Kane Willmott from IQ Offices and Scott Ashley from Get Ready. We are very excited about this webinar and the topic, and it's very timely and it's amazing, and we're going to have a lot of fun today. So I just want to make a point of making a very special thank you to the sponsors that help us run programs like this. Ottawa Board of Trade is a not-for-profit, and we rely heavily on the sponsorship and support from our members and from the community. So our community partners today are Tiger Lily Marketing and the Ottawa Citizen, and our event sponsors Enbridge Gas. And of course, today our presentation partner is IQ Offices, a good member of the Ottawa Board of Trade and a national organization. So we're very excited to have them here with us. This is going to be a great session. I'm going to share with you a couple of programs that we have underway in Ottawa for the reopening of Ottawa. We're in the midst of stage 2 and very excited about that. We've just launched reopening workshops with the Ottawa Public Health and City of Ottawa. These are sector-specific workshops to help different types of businesses prepare for a safer reopening. These are all on our website and our events calendar. If you need more information, reach out to me at any time. We have also just launched business peer groups. These are going to be peer-to-peer mentoring support groups. If possible, divided up by sector, and if not, it will be divided up by business issues that they are looking to solve. If you would like to apply to be a member of the business peer groups, again, you can apply through our website, ottawabot.ca. We're also working in partnership with the Toronto Region Board of Trade to bring you the Recovery Activation Program. This is an immersive online workshop program that connects businesses with industry experts for guidance and mentorship in how to become a modern and digital business, which we have now learned from the pandemic is critical for future-proofing your business. And finally, we are proud to be part of the group of chambers and organizations in Canada that are bringing you the Post Promise. The Post Promise stands for People Outside Safely Together, and it signifies a commitment to implement and practice the 5 key steps to workplace safety, helping to prevent the spread of COVID-19. So this is very timely in lieu of today's conversation. And again, you can learn more about the Post Promise on our website. I'm going to stop sharing my slide now and just give you a little introduction to our speakers today. So Kane Willmott is the co-founder and CEO of IQ Offices, a luxury co-working brand with locations across Canada in Toronto, Montreal, Ottawa, Calgary, and Vancouver. He is passionate about creating experiential environments where top performers are inspired to do their best work. Kane also served a 2-year term as president of the Global Workspace Association, with membership that includes many of the top performing co-worker spaces around the world. Kane is a registered real estate broker with 20 years of experience in the real estate industry, and his background and experience in growing IQ from 1 to 9 locations, along with his position in the GWA, have provided him with unique insights into the trends, benchmarks, and opportunities of this rapidly growing industry. And I'm sure the pandemic is also going to have an impact on the importance of co-working spaces as we move forward. We have a special guest with us today as well, Scott Ashley, the president and co-founder of Get Ready, Inc. I'm going to get Kane to do a little bit more formal introduction to Scott when we're ready to hear from him. So now, Kane, I am going to turn it over to you, and thank you for being here today.
Thank you for having me, Lynn. So yeah, I just realized that I definitely got to make my bio shorter. So maybe more of a bullet point, you know what I mean? But thank you for that. Thank you for that intro. So today we wanted to talk a little bit about, the storyline, what we're experiencing with COVID-19 in terms of the co-working industry. I thought we could, we'll make this very conversational. If you guys have questions throughout it, please feel free to just jump in and ask. What I thought we could do is provide a little bit of background on us being IQ, where we're at in terms of the co-working industry, and then basically what's happened since the middle of March, when we were, faced with this pandemic, and it started to impact our operations. So, just a very quick overview of us. That's the front page of our website. Here, we'll be talking about a workspace acclimation plan, which you can see at the top is on our website. It's our our response to COVID here. I'll be talking a little bit more about that later. But for our company, our roots started in 2012. Our first location was in Toronto at 140 Yonge Street, and we've grown the company from one location to 9 locations across the country. So now we are the largest Canadian-owned co-working operator in Canada. So we've got 2 locations in Vancouver, 1 in Calgary, 4 in Toronto, 1 in Montreal, and 1 in Ottawa. Today, I just noticed on our call too, we have Jonathan who runs our Ottawa location. So if there's anything specific to that location that you'd like to ask questions about, I'm sure Jonathan can answer some of those. And we also have Isabel Garcia, who runs the region of Montreal and Ottawa, and she's on the call with us today too. So, co-working overall, just to give a very quick background, when people ask me for like the elevator pitch of what I do, most people know what co-working is nowadays, but I just say, it's a hotel for businesses, essentially. It's very much a hospitality offering, much more so than it is a real estate offering. Very different relationships. Instead of being a tenant, we have members, very short terms. And when we got into this business in 2012, I'm a real estate broker. That's my background. I saw an opportunity because I understood the complexities of the leasing market, and I understood that the customer would be looking for more flexibility, not putting capital into space. Saw this as being like the iTunes of real estate, where you get on demand what you need when you need it, without all the hassle. So we just happened to time it right with WeWork coming out and the huge explosion in co-working that's happened since 2012. So that's a background on what co-working is. In terms of what we're working through now, I will take us back to the middle of March. I was in Calgary, and I got a phone call from our ops manager talking about kind of what was happening. We were keeping an eye on what was happening in terms of COVID. We anticipated that the government was going to be shutting down locations, and we got in front of that. We wanted to make sure that that our spaces were safe, that our staff weren't put at risk. And we started very early on opening up the lines of communication with both our staff and our members. We pulled our members our staff off site to a reduced work schedule. And we started communicating with our members saying, hey, this is what we see coming. This is what we've seen around the world. We were following what was happening over in Europe and Asia at the time. So we had a little bit of preview of what was happening. So we wanted to get in front of it. So I would say that we acted faster than most. And I think that worked to our advantage because we were a little bit more prepared and a little bit less reactionary in the early stages of this. And at that point, we saw that things were shifting, and it became imperative to us that we would have to create safe workspaces and build confidence in the workspace for our staff and our members, and of course their guests, anybody who would touch anything in terms of the IQ experience. So in the latter part of March, we went on a search, and we thought, okay, so first of all, we started doing some research on it to figure out what do we do to create safe workspaces. What became very obvious very early on was that there wasn't it wasn't easy to do. It wasn't something where it's just like, oh, do this and everything's going to be fine. There was so much education involved, and we were lucky, very lucky, I would say, that we found Scott and Get Ready Global, who specialize in emergency response, pandemic response, and containment. And we sat down with them and talked about, okay, well, what is it that we need to do in order to make our spaces safe? First of all, we knew we couldn't do it on our own, number one. Number two, we knew that in order to build confidence for ourselves, first, and then our members, and then our staff, and then our members, we would need to ensure that we had best in practice leadership in order to help us with that. And then from there, looking at like, how do we roll it out? How do we amend all of our operations? And one thing I can say that we learned early on was that the devil's in the details. There's just so many things that are involved in putting these plans together. Since we hired Get Ready Global, we have, there's been a number of design firms, accounting firms, brokerages that have come out with these plans that they show. This is what you need to do to make an office safe. You have social distancing, screening, sanitization, those sort of things. But what I can say is that's the 101, right? That is like, yes, these are the things that you need to do, but really understanding, first of all, what are the different aspects of those, and then understanding how do they apply to your situation. So for us, we are in the hospitality business. We have to sell our spaces over and over and over again, and we have to create amazing experiences for our members. We have to also be thinking about how do we create safe spaces. But then when we're thinking about like how do we layer this on, how do we make sure that people still have an amazing experience at work? Because first we got to build confidence so that when you come back to the office, you feel like this is the place I can go. I feel safe there. But then in addition to that, if you're coming to the office and your experience is impacted, you're standing at the front door for half an hour waiting to get in, like it's very difficult to move around the space. If we create a ton of friction around coming back to the office, that creates an issue as well, because we're not in the position of a typical employer where we can just kind of impose our will, for lack of a better term, and say, this is what everybody needs to do. We have to create an environment that really creates a great experience. So I think that puts us in a unique position, because we're told all the time, people vote with their feet, right? If we're not offering a great product, then they're just not going to buy our product. They're not going to stay. We're not going to be able to retain them. So I think we're in the unique position of figuring out how to take the safety element, build the confidence in the space, layer it into the operations, and then create an amazing experience where people are engaged and want to be back in the office. So through that, we built this workspace acclimation plan, and with Scott's help, doing individual audits of every single location. And that's every single office, every single desk, every single amenity, every single aspect of the operations at that location, in order to make sure that we were providing these safe workspaces. So this workspace acclimation plan that you see here is what we created to essentially summarize all of the things that we have done throughout the space. And it was meant to be, in its formation, was meant to be a communication piece, so that we could communicate with our members and build confidence in the space, let them know like what they can expect as far as the changes when they come back to the space, but also let them know that there are all these things that we've thought about. Subsequently to that, we realized that we are in this unique position. We have done all this work. We thought we have a responsibility to share this. We believe everybody deserves to have a safe workspace. So we put this out there. This is really very much an internal document in terms of an internal from us to our members, but we wanted to put it out there for people to understand. And I think it does a pretty good job at a summary. And later on in this presentation, I'm going to take you, as long as we have time, I'm going to take you through it. And I can show you where you can download it on the website. But I thought maybe we talk a little bit about, and I'm going to turn this over to Scott and talk a little bit about how we got to this workspace acclimation plan. So I'm not going to do the greatest job. Scott's going to do a way better job at explaining all his credentials, because they are, as long as my arm. But they very much are the professionals in terms of creating safe workspaces, looking at all of the detail, looking at everything that needs to be done. They certify our spaces. When they're done, they comply with the Ministry of Labor regulations, follow all the guidance of the World Health Organization and many others. So I'll turn that over to Scott. And Scott, if you could just share a little bit about your background and then take us through how we got here.
No, absolutely. Thanks, Kane. This is great. It's always interesting to find out what drives everyone to get their program, get their plans set up, and you guys clearly were out in front of everybody, really. And I think what you developed here. I remember the one day that Crystal and I first saw this after Brittany had sent us a copy of this. It was like, wow, this looks really slick. This is really nice. So yeah, we're excited to be part of it, and I think it was a great team effort, and it's been a really good run. So just quickly on my own background, I was a paramedic out west and down in LA and stuff, and I'm from Ontario. I came back to Ontario and I worked with Toronto EMS, and for about 8 years I was a critical care flight paramedic on the air ambulance service, which is called Orange. But we got into consulting early on, back in the early 90s even, when I was still working as a medic. And we just found that everywhere we went, people didn't have good plans. They just thought, I'll call 911 and great numbers would arrive and save the day. And that's not really how it happens. And, as I often joke with people, no one's coming to help you. And therefore, you better have your own plan. You better have it figured out. You have to be part of the program, part of the system. And so, we were doing emergency management. We got into business continuity back in about 2006, the follow-up from SARS and stuff, and the H5N1, the avian bird flu. And if you recall back, people were buying Relenza and Tamiflu and trying to figure out how to create a safe office and all these things. So we had that, and since that time, we've been building infection control programs for hospitals. And it's really this part. And like Kane was saying, back in March, they figured they had to jump on this. I remember my wife and I were driving up to her parents' place, and I thought, we're going to have to do a bit of a pivot here on our infection control program, because it's going to have to be rapidly deployable now. It's going to have to be quicker, more online, more tools, more apps and things like that, because normally pandemic planning is a pretty involved process, and there's a lot of workshops, a lot of meetings, a lot of moving parts that impacts the entire organization. And so companies and businesses and municipalities and governments and so on, they don't have time now. The virus is actually here. And so our purpose was to protect employees, the employers, the employees, the customers, to create consistent messaging, to make sure that the staff, the citizens, visitors are confident. This is much of a psychological emergency and disaster as it is a medical one. If people don't feel safe, they're not coming. They're not going to get out. And you see people walking their dog down the street, and they go way around each other. If someone's coming the other way and stuff. So people are concerned about this. So we wanted to make sure that it was easily and quick to deploy. And we also wanted to provide certification. So the best way to understand this, and I won't take a lot of time on this, but in hospitals, they've had what's called infection prevention and control programs. They have infection prevention control managers or specialists or officers. It's known as IPAC. Some people are calling it IPNC now. But at the end of the day, it's really about managing communicable diseases. And so if a hospital has a C. diff outbreak, or if there's a meningitis outbreak in the community, or seasonal flu, we've heard of these things, Legionnaire's disease, all of these different diseases have been happening for years. And, what are the characteristics of the disease? What's the treatment protocols, incubation period? How do people test and self-isolate? And how do you decide who needs what kind of PPE? And I'm sure all of you have been to the hospital at some point to visit somebody, or go to the ICU, or after the OR, or labor and delivery, or whatever. And you have to sometimes put on a mask or a gown or this or that. And then later on, you're still in the hospital, and you go down and you have a sandwich in the cafeteria. And nobody's nervous. Nobody's anxious, because hospitals have been doing this for a long time. They have it totally figured out. And it's part of their day-to-day life, infection prevention and control. And they're great at it. Now, the private sector, they now need IPAC, and they've never had it, they've never needed it, and now every single workplace needs it, and that's really the issue. And so we start with just a basic risk reduction, and this is just a model to give everyone a little bit of a background, how hospitals do this, how the paramedic services, fire, police, will think about managing this risk. So as we know, this is called a droplet-based illness. Unlike the flu or the common cold or meningitis, which is airborne, this is droplet. And the average adult can cough up to 6 feet of distance with droplets if they cough or sneeze. And so that's where the 2 meters, that's where the 6 feet comes from. In other words, don't cough on me, is the position. So how do we keep people distance? Well, we keep them, 6 feet apart. So that's our first rule, is can we keep everybody 6 feet apart? If we cannot keep them 6 feet apart, then what are the choices we have to help with that? And the first one is time. Maybe we can have people attend a room differently at different times. We can have different shifts. People come in on the early shift. Maybe, they're talking about this in a lot of workplaces. Maybe there's the crew comes in, people come in from 6 till noon, and maybe the second shift might come in from noon till, later in the day. Schools are considering this kind of thing right now. In a restaurant, you know, just to keep it really simple, you could have food prep in the morning, the cooks in the afternoon, and the dishwashers at night, you know, if you didn't have the space. Now, that may not work, but that's an option. If you can't distance yourself and you can't use time, then you look at engineered barriers, or what people are seeing in a lot of places, the plexiglass that's going up. Hospitals have them. You know, even in the emergency department, sometimes you'll just see curtains between patients and between beds. You know, that's sufficient enough to keep sort of the germs in that area. And ultimately, if engineered barriers and devices aren't going to work, then we look at PPE, personal protective equipment. And that's things like a mask, a gown, a hairnet. You see people wearing visors. We see a lot of people wearing gloves. For this particular illness, gloves really don't make any difference. You either wash your hands or sanitize your hands, or you have to sanitize your gloves. The most common way that these diseases spread is that someone coughs out a droplet, it lands somewhere, you touch it with your finger or your glove, and then you touch your face. You rub your eye, you touch your mouth, and I forget, you hear different numbers. The average person, you know, touches their face something like 3,000 times a day or something. So, you know, that's the real value of those visors, is it reminds you not to touch your face. But beyond that, it really doesn't do a whole lot. Wearing the mask is again, arguably helpful. Certainly for other people, you're protecting them because you're not coughing out droplets, perhaps. It doesn't really protect you from inhaling stuff. And so there's issues around that. A lot of people falsely wear masks thinking that they're protecting themselves, when in fact they're actually sort of protecting others a little bit better. But you need training, you need programs around this. And so this becomes sort of the risk reduction. We start with an assessment, and this is what we did with IQ. We have 175 different elements to the program in sort of 16 different categories. Everything from self-screening, how the person wakes up. We try to take them through their entire workday from the time they wake up to the time they actually leave the building and go home. So we look at screening, self-screening and screening, how they get to work. Do they take their car? Do they take transit? What should they be considering in terms of PPE? What's their level of risk? When they arrive, is there an elevator? Is there a screening station there? Can they just walk in the front door? You know, and so we take this through. Our minor findings are really best practice. Our major findings are guidelines. So Public Health Agency of Canada, Public Health Ontario, and each provincial public health office has guidelines. And the governments really haven't had a chance to sit and pass new legislation. A lot of these guidelines that are out there now will become legislative requirements related to health and safety. And so it's really about implementing an infection prevention control program into the workplace. Critical findings are legislative findings. If you give your staff a mask, you have to teach them how to don and doff that mask. In other words, how to apply and put it on, or how to doff and how to remove that mask, as an example. If people are cleaning, there's a difference between cleaning and disinfecting. You have to clean an area first, and then you can disinfect it for germs and virus and so on. So training has to be required there. We go through this process. We look at all the 175 different issues. We have the recommendations for it, and then we want to make sure that those recommendations at the end of the day are going to be compliant with what's called FACFO and OSHA and WSIB and so on. So that's really how we look at it. This is an example of the IQ Ottawa office floor plan. So using AutoCAD and distancing, we could measure every single space. And if I just go up in the top corner here, you can see this room 1006. For example, these desks normally would have been here, these desks over here, and these people sitting across from each other. So that now is too close. These people are too close. So what we've done is we've looked at either reorienting the space and the desks, the positioning of them. We've looked at putting plexiglass in, and there was a fair bit of plexiglass put in with IQ, and they did a wonderful job. And every seat has basically been measured out, and the path to and from their seats and so on, so that we can provide a safe environment for the staff. And you know, otherwise they're not going to come in. They're not going to sit there. And excuse me, you don't want to sit with your back to someone who's only 2 feet away. So we look at each of these areas. Here you can see in 1005 we have a boardroom. meeting room, and that kind of table isn't going to happen anymore. Training rooms and different meeting rooms, this kind of space over here. We've got, 10 chairs at a table that now probably has 4. So there's different kinds of furniture we need to consider, different kinds of strategies, how many people can be there. Obviously, over the last number of months, people have been doing a lot of video conference calling, using that as a great social distancing tool. But we basically examine each of the space. Now, this is an example of the screening process at the Ottawa office, and we map out the exact process. What's the flow of people in the space when they get off the elevator? What exactly is the procedure? And this is where I think, Kane had alluded to earlier that, the government agencies, provide, good sort of standard high level what you need to do. And what we always say, it's not what you need to do, it's what exactly do you need to do? And what exactly does the reception staff do? What exactly do they say? We try to give them the talk tracks. So when someone comes off the elevator, they can explain it very succinctly and very clearly. Again, 99% of the people that we talk to and deal with, they don't have the medical background. They don't have the confidence to, to really, am I saying this right? Am I using the right words? And it's those little details that make people very anxious. And so we give them the information, the proper signage, the protocols. So for people who pass the screening and they come on site, they have to sanitize their hands. Nobody comes past the elevator screening without cleaning their hands. Then they're screened, they use thermometers and temperature scanning and so on. Again, that a lot of people are asymptomatic, so a lot of people aren't going to be caught, but some people are caught by that screener, and we're trying to do everything we can do to provide the safest workplace as possible and to demonstrate that safety. And that's the real value that we see oftentimes in the thermometers. If someone does not pass, then they are told to wash their hands, they're given a mask, and they're given a self-isolation handout, 2-pager, that tells them how to go home, go home, see your family, but how do you share laundry and dishes, and what are the things that, we need to be able to do to keep people safe with their family. And so I think it's a very complete package in terms of creating a screening process. So it's an example of what we do at each of their sites. Here in these pictures, we have, you can see the floor plan, you can see the stickers, the decals, to keep people. Oftentimes, you've all maybe seen, like at a grocery store, they'll have rows of tape. So they'll have lines of tape every 6 feet apart and saying, that's your 6-foot space and that's your 6-foot space. Well, one person could be standing at the edge of their box and another person close to that same side, and now they're only 2 feet apart. Whereas if you have the circle, they stand on the circle, which is at least 6 feet from the next circle. And that's what helps provide that proper social distancing, or what's called sort of physical distancing. Social distancing was the lesson we all needed so that we learned not to shake hands and sort of fist pump and hug everybody and stuff like that. Over the last 3 months, as you all know, most people don't do that anymore. They even sometimes they reach out and they go, oh yeah, no, hang on. And they remember not to shake hands. Well, now the physical distancing is the big piece. We want to make sure that we are keeping people apart. So in the second picture, you can see here where we've put in plexiglass, both beside the workstation and across from the other people. The third one here is a picture what normally would have been a little coffee area where there would have been 2 chairs at that table and people could have sat down and had a conversation. It's now a space for 1 person. With food, and I know, Rakesh, you had mentioned about this earlier. So IQ used to have these lovely spaces for coffee stations and taking a break and so on, and they had some food that was available. Now it's all, as we sort of call it, airplane food. It's all individually packaged, so people aren't digging into a bulk container of pretzels or whatever could have been there. So these are the kinds of changes that have been going on. This is an example of a reception area now, so people can see it's very well labeled. It's very large font. It's easy to read. They get off the elevator. They can see what's expected. You're going to be screened. Please stand here. Do this, do that. And you can see there's hand sanitizer stations and so on. And then again, you can see the arrow on the floor that shows them the the wayfinding and stuff, so they have proper flow and direction, so that we're not having two people meeting up in the hallway. And people are really abiding by that. I think it's working very well so far, and that seems to be a good indication. Here's just another picture. What was a larger table before for 4 is now a table for 2. So again, having proper signage, proper consistent messaging is really important, and I think IQ has done just an absolutely great job of that. It's very professional, and yet it's very clear to people what they need to be doing and what's the best practice to keep everyone safe. Within our program, we built this cloud-based tool. It's accessible on their desktop and their mobile device. In there, we have access to all the content, the procedures, even the policy documents. We have cleaning practices and protocols. So what is the cleaning schedule for common areas, for offices, for washrooms, for kitchen areas, and so on? What does a deep clean look like in the event that someone is exposed? Or we have a situation where someone says they phone in the next day and say, hey, listen, I was just tested positive. I'm not going to be back in. Now we have to go back to that area where that person worked and the areas that they might have been visiting with others or sitting, having a coffee or something. And those areas need to be deep cleaned. So all of that information is quickly available on managers' phones so they can see it. We also have an online awareness training. This is kind of like the way WMIS rolled out, 20 years ago. And everyone's like, what is this WMIS thing, And well, now they're saying, what is this IPAC thing? And we need to educate people. What is the terminology? What does contagious mean? What does transmission mean? Incubation period, signs and symptoms, and why did they change? And, there's a lot of confusion over masks and gloves and screening and this and that. So we need to make sure that all staff are trained. This is actually a important component of the certification piece. We want to make sure that the staff are trained so they can do all the training online. Managers can see and get the reports as to who's started, who's in progress, who's completed the training, and so on. We have attendance reporting. This is a really critical piece. Who's arriving, and this works at the screening station. This works for visitors or guests or customers coming on site. Certainly works for staff in the IQ case. The tenants, the staff themselves, anyone, if a customer or a guest is coming to one of the tenants, we can enter their information very simply. We're not gathering all their personal information. It's their name and their cell phone and who they're here to see. The typical information that most people would have written down on a binder sitting at a reception desk, typically. Nobody wants to see the binder. Nobody wants to share the pen that's sitting on the counter. And so now the reception person can just put this information in. If staff are phoning in sick at the start of the day, it can now be tracked. Why are you sick? And there's simple drop downs. The whole form takes a minute to fill out. But from a management perspective, you can quickly see by site, by department, who's sick, where there's absence. So this helps with your business continuity planning to make sure that you have the right number of staff ready to go without lots of emails and phoning. It's all dashboarding on people's phones. So it's really quick and easy to use, and it's been very popular. This is a Get Ready emergency app. We built this for first aid, for first responders. We have, at the time, we had probably 60, 68 or whatever videos on how to do CPR and choking and how to stop bleeding and give an EpiPen and Narcan and all these things we all used to hear about in the news, mass casualties and what to do and quick little treatment videos. But we've added a whole bunch around sort of infection control. So hand sanitizing, use of masks, donning and doffing gloves, assessment, self-isolation, and so on. And this is an app that most of the companies then get for their staff, at least for their managers to have this. The daily status report, and I'm almost finished here. So the daily status report is the final piece. And this is what allows organizations to track every day with IQ. Their managers are at their sites, open up the phone, they answer these 5 questions. Is our screening in place? And they can take a picture. Do we have hand sanitizer available? Yes. Social distancing? Yes. And they can take a picture. It's simple. Click, 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 and they hit submit and they're done. And again, from a WSIB, from a Ministry of Labor perspective, we want to be able to demonstrate that the organization is in fact compliant and meeting the requirements. They have proper infection control measures in place. And this is the second part of the certification. So once an organization trains their staff and brings this in, then we provide that certification so that they know if there's an issue, they have the information available and they're doing it right. At the end of the day, we give a certification piece, and I just want you to note this this photograph that's in here. This is an image of King Street and University Avenue in Toronto. If you know that, this was taken at 1:03 on a Tuesday afternoon, and you can see there's 2 vehicles on the road and 1 parked. And that's where we originally came up with the name of Return to Work. So, sometimes, and I know we've all seen this in all of our cities, and I know Ottawa's no different. But it's just a real shock when you see that kind of stall in the entire workforce and economy. So that's really what we've done, and I'll turn it back over here now to Kane. And this is, again, I think I'm going to stop sharing here, Kane, and you can jump in and show some highlights and details of what's in the actual document you guys prepared.
Okay, yeah, that sounds good. So does anybody have any questions? I mean, there was a lot of information in there, and there may be people that are on the call that have some situations that they see specific to some of the things that Scott was talking about. I can tell you he is such a great resource. In terms of COVID, he's basically like our therapy sessions. What do we do about this? What do we do about this? And talk to Scott, and it's like, oh, great, some answers, So I encourage you to ask some questions if you have some.
Yeah, I have a quick one, Scott. So great detail there. You should package that as information to share and change that out. So I work down on King Street, not too far from there.
Okay.
Outside the office space, what do you foresee from an elevator point of view in a 64 Scotia tower?
Yeah, it's a real issue. But you know what, it's manageable. I think there just has to be some agreement amongst the major tenants in the building. We were at one building the other day downtown in Toronto, and they've got about 800, this particular client has about 800 people that have to get up into the tower. And the plan they're working on right now is to have access to 4 elevators. And they've decided that they can put, right now they think they can put 4 people in the elevator. Technically they could put 2 if you use the social distancing. So one of the rules that we go by, and is a fairly standard rule, but people don't hear about it very often, is the 42 square foot rule. So take the number of square feet. If you had a room, technically 420 square feet, you could, technically you could put 10 people in that space. Well, most elevators, as you know, are relatively small. So, even the big corporate towers, they're still fairly small spaces. So we've looked at two people per elevator, and they have 4 elevators, and I forget all the quick math on it, but it was, the average run up and down was 5 minutes. So if you're moving, 8 people every 5 minutes, it's going to be all day before you're going to get 800 people up into the tower. So one of the considerations is, again, sort of going back to that risk prevention piece. If you can't adequately protect yourself with distance or barriers, which you're not going to do in an elevator, then possibly the rule is to put on a mask while you're on that elevator ride. And literally for the minute it goes up, to the 10th or 20th or 30th or whatever floor you're going to, you're going to wear a mask, and then when you come outside, you could take it off again as you enter your workplace. That's a possibility. Obviously, time is an issue. They're looking at, a lot of the clients we talk to, easily 20% are looking at rotating shifts of not coming in on a particular day, so that reduces the number. They're looking at staging it. Let's just keep the math simple. The first 2 floors, they'll come in at 7 a.m. and the next 2 floors at 8 and then 9 and that kind of thing, and staggered a little bit. But, in some of these towers, First Canadian Place in some of these buildings, like there's, 8,000 or 9,000 people in that building. Like it's a real issue, right? And you can't just hike up 53 stories, to go to work every day. But that's part of our assessment, and we review that. It's the screening. Are you going to have guests? What about vendors? A lot of the places, for example, they're not allowing people to order food because it's going to because one, we don't want the vendor coming in the building, like upstairs, period. But secondly, if you were even to go down, and some people have suggested to go down and meet the pizza guy or, whatever, you know, your Chinese food order or whatever you've ordered, it might take them 45 minutes to go down and get back up again.
Yeah.
You know, so it's a real, that needs to be scoped out for sure. And then even within the building itself, as you know, a lot of the companies, a lot of the employees, we use stairwells, internal stairwells or the fire stairwells, you know, the north side of the building, the east side, south side, whatever. But even that, with the building property manager, there needs to be an alignment. So the north stairwell, for example, is a going up staircase, walking up from one floor to the next kind of thing. And the south stairwell is going down, you know, so that, again, you're not getting people crossing in that small space, you know, within the staircase.
Okay, thank you.
That's a great answer, Scott. Thank you. In the interest of time, let's leave a few of the questions to the end, because to me, the reason that we're all here today is really to see the culmination of, you know, Kane's thought leadership and your scientific backing. And let's see this work acclimation plan, because I really think this needs to be shared.
There you go. So I've lost you there, Kane. I think you're on mute.
Yeah.
There you go.
There you go. Okay, we better?
Yep.
Okay.
Yep.
All right, I'll say that again. Just 1 second. Let me just share my screen here. I got to get to the right spot. Okay.
There we go.
Everybody can see that okay?
Yes.
Perfect.
Okay, great. I've just got it on our screen. That's why I'm looking that direction. So this is the workspace acclimation plan. This is what we provided to all of our members. What we did at IQ is we went one by one to every single one of our members. And to give you an idea, that's thousands of people, and called them and walked through this plan, specifically said, here's what we're doing. Here is what you can expect when you come back on site. We had all of our members sign a document saying that they were going to adhere to the policies to ensure that we were creating safe workspaces for our members. One of the things to mention about IQ is that a big majority of our membership is satellite offices of larger organizations. So it's an enterprise clientele. And one thing I can tell you is that the Googles and Indeeds and Alibabas and the larger companies out there, they're all requiring that these things be done in order for them to return back to the office. So it's not something where it can be like, well, if you want to, or it's a suggestion, you know. And I can say that that's one of the things that we had to determine early in the process, whether we were going to enforce this or whether it was going to be, hey, here's what you should probably do. And we believe that in order to make sure that our staff are safe, we have to police it to an extent, to make sure that, like, if people aren't social distancing in the common areas, we're going to be paying attention to that and making sure that that's happening. And in the offices themselves, what we've seen some co-working operators do is essentially leave everything the way it was and say, well, sit in that chair, don't sit in that chair. And if you create an environment where there can be abuse, I think that it will just happen, you know. And I think people just will become complacent because we're all busy and we're all doing a number of things. And I think that if you create these environments where you reduce the friction, you reduce the opportunity for abuse, you can create these safe environments that also have a great experience. So I'll take you through this document and as quickly as I can. This is available on our website again. If you go to our website, top banner says response to COVID, like Scott had shown in the first slide of the presentation. You just throw in an email address there, and you can download this whole plan. So we call this the Workspace Acclimation Plan, which is really getting back to work. This is really a summary. This is how we've kind of taken all of the technical aspects of what Scott was explaining and really drilling it down into different elements and making it communicatable. So it starts with where is one of our taglines, and we talk about an informed strategy. And then basically we looked at 5 workspace essentials. So we broke it down into these 5 components, which as we're explaining this to our members, we're talking to them about, like, everything in itself, all of these different 5 workspace essentials on their own are effective in their own way. But when you start to layer them on top of each other, you start to see a compounding effect of reducing the risk as you're operating the space. So this is the document here. We have some very talented people in our marketing department who were able to put this together for us, which is fantastic. We talked about Get Ready Global and all of the elements behind the plan, the guidelines that we are following. And then we go into screening and really giving people a preview of kind of what this space is going to look like. We opened Vancouver. This is 550 Robson in Vancouver. We opened Vancouver on June 1st. So we've had 18 days of operation in Vancouver, which is one of the great benefits of being a national operator is we've already had more than half a month of operating experience in these markets to see how people are responding to the different initiatives that we're doing in the space. We're able to implement that in our other locations, Calgary, Ontario, and Quebec as well. So that there's been a lot of great learnings there going through this process. One thing I can tell you too, from a timing perspective, so we started this initiative end of March. We opened up here in June, and I can still say that we were scrambling to get everything in place in terms of all of the signage, all of the operations, all of the procedures, all of the training, everything for June. So like this is a couple of months of intensive work. We added up some of the hours internally of our different resources. We're over 1,500 human hours to create this program. So this goes through kind of what they can expect when they come back to the space, talks about the on-site screening and what happens if they fail the process versus passing the process. We have everyone in our space has wristbands, which is a visual marker showing everyone around the space that they've been through the screening. So they've taken the self-assessment, they've checked temperature. So you know when you're in the space that someone else who's in the space who's also wearing a band has been screened as well. Because again, it's all about confidence. It's all about creating that confidence in the workspace so that that safety element just can kind of fade into the background and they can focus on their business. Then looking at, again, more visuals. This is what you saw in that picture when people walk into the space, explaining how everything works. These are the questions that are being asked. Then we looked at our cleaning protocols. And I can tell you that that cleaning is always a challenge. And it's something that we had to really look at all of our operations. In some locations, our landlords are responsible for cleaning. In other locations, we're responsible. In many locations, the landlord has cleaners as well as our cleaners. So we had to look at what do we need to do to ensure that our spaces are clean, to ensure that there's cleaned and sanitized. So we have these signs throughout our space that talk about when was the last time that area was clean. So again, visual marker. So if I walk into that space and I see the last half hour that space is being cleaned and sanitized, it gives you more comfort throughout that space. But it's also an accountability measure too. And I can tell you that we are like our operations people have went into every single location, understood exactly what the protocols are from the cleaning perspective. And if they don't meet our standards, we are bringing in our own cleaners. And in some cases, we're actually excluding building cleaners from doing any cleaning on the space because they're not able to meet our standards. In terms of the private space itself, as mentioned, we did an individual audit of all the spaces. There was a de-densification of some of our spaces. So in some instances, we were calling a member and saying, hey, this was an 8-person office. Now this is a 7-person office. And here's what you're going to see, the use of plexiglass. And we have these desk mats as well, that when you come in, you can take the desk mat, put it on your desk, and then you do your work. You take that desk mat away with you. Again, all part of the experience. What we found, I think we were in a good position from our organization's perspective, is that we didn't over-densify our spaces to begin with. We weren't looking at putting, desks, one desk for every 30 square feet. We've always believed that in order to create a great experience in your space, you need to have space. And so we've created larger hallways, which allow for some bypass going back and forth in some areas, but of course we've done directional signage as well. But we really didn't have to do a ton of de-densification because we were able to use plexiglass, and because we hadn't densified hugely in the beginning, it didn't have a tremendous impact. But I do believe it will have quite an impact on many businesses. This is looking at all of the shared spaces. This is 1055 West Georgia in Vancouver. So prior to COVID, there would have been 2 to 4 seats sitting around all of these tables. Now these are 1-person seating. We have all of these visual markers throughout the space to say how many people can sit in the booth areas. We have directional flow around these spaces as well to ensure that we maintain social distancing throughout those spaces. we've also created flex spaces. So for those offices, for two reasons. For those offices where we've taken desks away, we've provided this as a complement to our members, so that if you have 8 people and you have 8 desks and we just took away one of those desks, you have an opportunity to go to a flex space. So, and the flex space is cleaned on the same cycles as all of the amenity spaces. In addition to that, what we're seeing a lot of now is many companies that are coming in, especially in Vancouver, because we're signing more transactions in Vancouver because we're open. Many companies that are 20 people are looking for a 10-person office, 10 people looking for a 5-person office. So they're starting to see that, like, people are doing this hybrid work style. They're recognizing the fact that they do not need one desk for every employee that they have. So I anticipate that this is going to have a significant impact on the office market, because what you're going to start to see is when people come up for the renewals, they're going to be saying, I don't need this much space. I think we will be the beneficiary, us as an industry and co-working will be the beneficiaries of this, because I think the reality is most people, especially with what's going on now, have no idea of what the work style is going to look like in 2 years from now or 5 years from now. So signing a long-term lease with no flexibility and investing into that space is going to be, I think it's going to be a challenging value proposition when landlords are speaking to tenants about securing space in that way. So for us, co-working, you can literally come into the space. You have 10 people, you can do a 5-person office. If that doesn't work for you and you need more, you can just go and tack it on. You can grow, and you have complete flexibility to do that. In addition to that, we're set up for it. So we have these amenity spaces. And what we're finding too is that people are working on rotations. So when they're working on rotations, people aren't in the office every single day. So your office manager, as an example, maybe your office manager is coming in 3 days a week on a traditional office basis. Well, the office manager, in many cases, is the one stocking the fridge. Maybe that's the one making sure that the photocopier is working, that talking to the cleaners, making sure the cleaners, those things are happening. Well, now they're not on site every day. So this is another great value, is that with a co-working space, everything's taken care of. If you don't go to that space for 2 weeks and then you drop in for 4 days, you're not thinking, oh, geez, is there spoiled milk in the fridge, and everything else that goes along with abandoning space for a period of time. So this is just more examples of looking in our offices. We have occupancy counts in each one of our offices, capacity markers, which I talked about earlier, just some visual examples throughout our portfolio of what this looks like. Our booths right now, they're 1 person as opposed to being 4 people. Luckily, we have quite a bit of amenity space within our spaces, so it does accommodate. We're also finding that the utilization, again, is going down. So we find that many of our offices, people aren't using them as much because they are doing this hybrid work style and working from home. This goes in talking just a little bit about the hybrid staffing schedule, which I talked about. We're in the process of doing this with our own staff. We have 25 staff at our head office, and we are going to be releasing all of the documents that we've used to implement a hybrid working style at IQ. So we went through, for every single staff member, had a questionnaire. We understand if they're at high risk. We understand what their commute looks like, what their form of commute, how long it takes, what their situation might be if they have, childcare obligations, those sort of things, looking at what the optimal schedule is, and then putting it all together, getting the right people in the office at the right times. Because you can use the technology and it's great, but it still doesn't replace being in the same room with each other in terms of creating that culture and collaboration. And then we talk about adoption, which was what Scott had mentioned with some of the airplane food, and so forth. We used to have a trail mix snack bar, which was a highlight. So everybody loved the trail mix snack bar because you could just go in every single day and it's healthy snacks and kind of keep their blood sugar, without spiking. And so we had to look at, well, how do we do that? So we had to rethink every aspect of our offering and think about how we implement safe protocols for each one of those things. So we talked about the additional services as well. One of the additional things that we're doing is we can offer more heightened cleaning of the office space if they want that too. So that's becoming part of the offering. We are really becoming experts in cleaning. We always were. It was always very important, but there's completely new elements to it now. And what we found is many of the cleaning companies out there aren't prepared for what they need to do in order to create the safe spaces. And then lastly, communication. And this really comes down to communication. And that is not a one-time thing. We did reach out to every single one of our members, have one-on-one conversations, had them sign a declaration in terms of how they were going to act within our spaces. But communication is ongoing all the time. And just letting them know exactly what we're doing, how it works, being ever present, ever visible. there to answer questions, but communication is a key component to creating that confidence in the workspace. And then we went through some of the self-screening. This was the appendix, which was referenced earlier in the document, talking about the self-screening protocols and so forth. So this was the questionnaire. These are all meant to be tools. So if this is something that you're implementing at your office space, this is something that you're welcome to mimic. This shows exactly how we're doing it. And then we talk about all of the processes here, and goes through everything that we're doing, talking about a little bit more in depth about like our cleaning protocols and so forth, and then talking about how we're dealing with the different elements of the space. So this is meant to answer most of those questions in the document form, but it is a talking document. It's one that we walk through the elements of this document with our members, and ultimately this is something that they can share as well with their staff or new people that are coming on site too. And then again, we reach out for that communication too. So this is the document, and it in total is 28 pages. We are working on condensing a little bit of a shorter one to make it even a little bit more digestible. But I think this is a good resource for anybody who's looking at creating safe workspaces.
Thank you, Kane. I personally think this document is absolutely brilliant. When I first saw it, I was blown away. My first question was, how do we get this information out to other businesses? I think that IQ offices took a real leadership role here, both within their own sector and just generally in the business community, to put together something like this that is full of clarity, which people are dying for. They need to understand the rules, and they want people to make it easy, and they want people like Scott to give them the rules to follow. And it's all here. I congratulate you on how beautiful the signage is in your places. You know, I've been into a few stores and the stickers are there and they're helpful, but they're ugly. And IQ has obviously kept them elevated in keeping with their brand. And just the thoroughness of it, and the fact that it's science-based, it's brilliant. So I took the liberty of putting the download link in the chat if anybody wants it. I want to make it easy for people to access this document. We only have like a couple of minutes left. So is anybody got a question that they really want to put to Kane or Scott right now while we're still live? Go ahead.
Just real quick, thank you, Kane and Scott. That's great. And again, I am familiar with your buildings, and I have put a few tenants. So I'm in commercial real estate and negotiating for tenants for 20 years. And I think what you're doing is really smart, because yes, I believe there is an opportunity. I agree with you 100%. But I think in this market, you know, I like a tenant's market because it's been a landlord's market for so long, but you might be faced increased competition as space becomes cheaper. There's more people that think they can get into the business center space, and then it becomes competing on price. And I've seen that before with the ups and downs in the market. But what you're doing here is you're separating yourself, and I would feel much more comfortable recommending one of my tenants to IQ office rather than another startup who's come and is taking advantage if there is a price decrease going forward. It's a bit of a falling knife right now. Who knows what's going to happen with the commercial market? But what you're doing here is separating yourself, which I think is extremely important.
Thank you. Thank you for that feedback.
Well, I couldn't agree more. Kane, you know I'm a huge fan. I'm a huge fan of IQ, period. But this document needs to be shared. And I also applaud you for your leadership in being willing to share it and tell people, use it, copy it, base your own on this. I mean, it's one of the great things about the pandemic is that it really has fostered a sense of community within the business world, and people are willing to share their expertise to an extent. And I just think this is an amazing document. I would not hesitate for 1 second to visit an IQ office space. I am completely confident that I will be safe and healthy on those in any of those locations, and I think that's the whole point. And so I think that's a great way to end. We are just at noon now. Please share this information with your networks. We are going to post this on our website so that people can rewatch it. but I really think that businesses need to pay attention to how IQ Offices has done that. I am absolutely convinced that you guys are poised for success. There's no question. And I want to thank you, and I want to thank Scott too for coming today and sharing your expertise. Have a great afternoon, everybody. Thank you so much.
Thanks, everyone. Thanks for joining.
Guys, great job.
Bye.
Thank you.